There are common problems which can occur with any CVAD. Knowing what to watch out for will help you quickly manage these problems with your healthcare team. The most common problems include blockage of the catheter, infection, catheter tip movement, catheter breaks. A blocked catheter means that you cannot give fluids or medication through the catheter. Sometimes you can push fluids in, but cannot withdraw blood back. Flushing the catheter properly and making sure the catheter is clamped when not being used can decrease the risk of blockage. If you think your catheter is blocked, check the tubing to make sure it is not kinked or bent. Change your position and lift your arm up. The catheter tip may be hitting against a vein wall. Sometimes a change in position can move the tip slightly. Inform your healthcare provider of any flushing difficulty or blockage. They may be able to open the line by giving you medication that dissolves the clot and residue. Call your healthcare team immediately if you have a swelling in the neck or arm area. This can be a blood clot. An infection can occur in the bloodstream or at the insertion site. Check the insertion site daily for redness or swelling. Report any fevers greater than 100.5. If you have an infection, you may be given antibiotics in the line or the line may have to be removed. Infections can be prevented by washing your hands anytime the catheter is touched, using gloves and masks when working with the CVAD, cleaning your work area before inserting medication or fluids, vigorously scrubbing the hub of the needleless connector for at least 15 seconds, storing and mixing medications and fluids correctly. The CVAD can slip out. This can be due to the catheter being poorly secured, tugged at, severe coughing, and excessive arm movement. Tell your doctor immediately if the tubing is getting longer outside of your body or if the implanted port seems to have shifted position under the skin. If the catheter comes out, take a sterile gauze pad and apply pressure to the insertion site until it stops bleeding, and call your healthcare professional. This can be prevented by regularly checking your catheter to make sure it is secured. Measure your tubing length and make sure it hasn't changed. Create an extra loop of tubing. Keeping your tubing off the floor so no one trips. A tunneled catheter can become damaged. This can be due to a lot of clamping or bending in the same spot. If the catheter breaks, immediately call your healthcare team. Use your emergency clamp and clamp the catheter between the damaged part and the skin insertion site. You can also place a piece of sterile gauze around the break site to cover the leak. Immediately clamp the catheter closest to the chest and call your healthcare team. If there is 2 inches extending out of the chest, the catheter can be repaired. Prevent breaks by keeping the tubing under your clothing. For infants and children, this will keep them from pulling or chewing on the catheter. Clamp the catheter in the designated spot and check for wearing of the tube. Other problems include blood backing up into the catheter. If you see blood in the line, follow the steps for flushing the line with normal saline and heparin, if required. If your line has a clamp, be sure it is closed. Call your doctor or nurse if you continue to have blood backing up after flushing. Sterile dressing not sticking. Sweating, extensive movement, or the dressing getting wet with bathing can cause it not to stick. Talk to your nurse about trimming the hair around the site or using additional sticky adhesive pads before placing down the dressing. For a PICC line, be sure to wear a shower sleeve or wrap around the arm with plastic wrap. For lines inserted in the chest while showering, you may want to cover over the dressing with a small plastic bag. Air in the catheter. You do not ever want to have air in the catheter. If the air goes through your line and into your bloodstream, it can cause chest pain or shortness of breath. If you see air, you should clamp the catheter right away, lie on your left side, and call 911. You can avoid getting any air in your line by making sure the fluid tubing is flushed totally of any air before it is connected, making sure that there is no air in the flushing syringes, arm or shoulder swelling. If the vein where the catheter is placed becomes occluded or closed off, you may have arm, shoulder, neck, or facial swelling. Call your doctor immediately if this occurs. The clot might be treated with blood-thinning medication. The catheter may have to be removed. Emergencies. If you experience any of the following things, contact your surgeon or nurse immediately, or go to the nearest emergency room. Infection, fever or redness at the site. Swollen arm or neck. Drainage or break from catheter site. Keep emergency telephone numbers in your home, vehicle, and wallet. Make sure family members know where to find them.